The idea behind CRASHCART is bring a digital lifeboat to a hospital under ransomware.
Has anyone not heard of ransomware, right? And that's essentially when malicious hackers come in and encrypt computers on networks. Patients can't get prescriptions filled, they can't get the results of studies, they can't go in and see their doctor if they're feeling sick.
We respond with things like vans full of equipment and those pre-deployed technology, have some emergency laboratory systems and radiology capabilities, and then the goal again is just to support safe patient care. The thought you could bring in a temporary system, new computers, new networks, supplementary laboratory equipment or radiology, and have the teams work on digital systems as a temporary stopgap, a lot of people thought that wasn't possible. But we were funded by ARPA-H, and the idea behind ARPA-H is really moonshot ideas, not incremental changes in the way that we approach disease or how we treat health, but really huge leaps, because those are the things that are going to matter when we build the system better and we respond to a real ransomware attack.